San Mateo County voters overwhelmingly approved a half-cent sales tax in November to help pay for local services. In its first full year, the tax known as Measure A is expected to raise approximately $64 million. Joining me now to talk about how the Board of Supervisors will set spending priorities is Don Horsley, President of the Board of Supervisors. Don, welcome to Peninsula Newsmakers. And
thanks, Marshall.
Thanks for coming. And tell us, how is the board going to set funding priorities?
Well, tomorrow we're going to have a meeting just on that, and we'll have lots of input, I'm sure, from the public. We'll have people who are interested in mental health, some school people, parks people. So there'll be, we actually, if you looked at all the literature that when we passed Measure A, or not, when the board actually put it on the ballot, we talked about all the potential things that we could spend it on. And for example, like child abuse prevention, fire service, 911 service, some law enforcement issues like gang task force. A lot of it had to do with health issues, though, for disabled, for seniors, for children. So I suspect we'll hear a lot tomorrow about the needs. The county and the state and the federal government have cut back on, if you want to call them social services and the safety net for a long time now, and certainly the county did for the last 5 or 6 years. And so we'll probably be asked a lot to restore a lot of those services.
Now, it's been well publicized that the Seton Foundation put up quite a bit of the money for the campaign for Measure A. Has Seton formally approached the county about some sort of funding agreement?
We have talks, yes, and we actually have talks through our health plan. And the health plan, as you know, one of the ways that we set up our Medi-Cal and other programs called ACE, and it's for people who are need a lot of help from the county.
Right.
Most of our Medi-Cal patients actually are at Seton Hospital. So we want to make sure that Seton is successful and vibrant, and we want to make sure that that network of physicians remains in a part of our health plan system. So it's really been, there have been a lot of discussions, probably pretty formal discussions between the health plan and Seton. And what the health plan is going to be saying is that we want to have a healthy, vibrant network of primary care physicians, because that's how the medical services work today. So, you have a problem, you go see your primary care physician, who then sends you to a neurologist or an orthopedist or a rheumatologist or whatever specialty. So we want to make sure that that network is healthy and vibrant and growing. And there are other services that Seton provides, skilled nursing, for example. On the coast side, there's a 116-bed skilled nursing facility. So there's a variety of services that they currently perform, and we want to make sure that those services will be able to continue in the future, and maybe even some additional ones.
Now, I know one of your priorities on the board has been the parks. And
yes.
Parks are a very large part of your district, District 3, encompassing most of the coast side. Is there a chance that some of these Measure A funds could go to the parks to improve campgrounds and some of that infrastructure?
Well, I'm glad you asked that, because in fact what we are going to do is we will hear to some extent tomorrow from advocates for the parks, but I really set up a subcommittee, myself and Supervisor Dave Pine, who also shares that interest. And the interest actually goes back to a couple of years ago when the two of us were on a joint committee. So we are going to have a subcommittee meeting with the Parks Commission, and we will invite all of our parks have friends. For example, Fitzgerald Marine Reserve has the Friends of Fitzgerald Marine Reserve, and San Bruno has the Friends of San Bruno Mountain Park. So we'll have all those friends groups and the Audubon Society and the Committee for Green Foothills come in and talk to us about the needs for our parks in the future. And I'm guessing that what we will do, we will probably, we also have a master plan, by the way, I forgot to say that. We'll probably kind of designate about $2.5 to perhaps $3 million for the parks, because they've been cut back so much in the past that it's fairly easy to cut back on parks because it's not like public safety.
Right.
So they are in need of both staffing, naturalists, and there's a lot of infrastructure projects. So it would be a division between some additional staff some infrastructure projects, as well as, instead of just waiting for the disaster to happen, do some things that were predictive of the kinds of things that need to be done in our parks and our creeks and things of that sort. So yes.
Do you think, when it comes to Measure A, do you think one of the most important campaign points was that it was local funds for local needs? That I know there's a lot of concern that the feds, the state keeps taking away money. Now they can't touch this money, right? It's local tax dollars.
That's what I think. That was one of the points, is that, well, we said this is local money for local needs, and we were talking about health services for Seton Hospital or the North County, but there are also things in the South County. We have a small community of Pescadero. They don't have a doctor. So we want to make sure that there are health clinics in all of our communities, especially clinic areas. Clinics are really needed in an area like Pescadero, where you have farm workers who really don't have access to good quality health care. And if you don't have good quality or good access to quality health care, what ends up happening is that you end up with diabetes, with hypertension, with heart attacks, with strokes, and then the cost to the county and ultimately the taxpayer is considerably greater. So I think things, making sure that our clinics are providing the services that need to be provided. We do a lot of prevention. I think those are important things, and they are not only the right thing to do, the humane thing to do in the long run, they're the cost-effective things to do. And one thing you forgot about is fire service. We also have concerns about our fire service. We haven't replaced equipment, so we need to put money into an enterprise fund to replace the aging equipment. And I know our 911 system, we want to make sure that is vibrant, that it's in a place that's safe, that in the event of a major earthquake, that our 911 system is going to work, and that people are going to be able to get the help,
right,
the fire department, the ambulance that they need.
I wanted to touch on something. A lot of people, when they think about San Mateo County, think of Fortune 500 companies and biotech and high-tech research, but you talk about a community like Pescadero, which doesn't have a doctor. Now, a lot of our land is in agriculture, and you want to keep it that way. I know you had an ag summit last year. Tell us about, why is it important that we have agriculture here in San Mateo County?
Well, that's an interesting question, is that San Mateo County agriculturally really grew up as an agriculture county that supplied the city and county of San Francisco. And the coast side, as you say, still has a lot of agriculture. I think it's important for a couple of things. First of all, people have become much more interested in having wholesome, organically grown, local food. And for that reason alone, I think it's really important to have that access right here. So when we have a lot of these, we have commercial growers, and we also have organic growers, and they supply a lot of the produce that all of us really thrive on. We think about artichokes, Brussels sprouts. When I was a kid, I hated them, but I love them now as an adult. So they grow a lot of things on the coast side that go directly into our farmers markets, directly into our supermarkets. So I want to make sure that we don't keep on chewing up farmland in San Mateo County to become like McMansions. And so that's what we're trying to do, is preserve an agricultural history, I guess, if you will, and at the same time make sure that wholesome quality food is grown locally and delivered here locally. The other advantage is that if you think about greenhouse gases, if you think about, do you want to have produce shipped from around the country, from someplace else, from Canada or from South America, or would you rather have it here? And so that's what we're trying to do, is preserve land, preserve agriculture in our community, and make sure that we have access to wholesome, locally grown food.
We got about 30 seconds left. Quickly, what are some goals for 2013 as board president?
Well, one of my goals is to restore a lot of services to mental health and to work with our schools. For example, we had that horrible shooting in Sandy Hook. And it seems to me that one of the things that we should be able to do is work with our school authorities and figure out, is there some way, they've got all the kids in our community, and they really we need to work with them so that we can identify those youngsters who are having problems at an earlier stage, so we can avoid problems in the future. So it's, so I plan on working pretty closely with school authorities and see what is it that we can do in terms of mental health to strengthen their systems to make sure that those kids who need help get the kind of help that they need so that we don't end up with tragedies down the line.
Terrific. Don Horsley, thank you for joining me on Peninsula Newsmakers.
Thanks for having me.